Okay, first question of the month. What is the difference between a deductible, coinsurance, and copayments? And why do I have to pay them if I have insurance? Okay, this is one of those questions where it normally, if I were to receive a question like that, it's something that would normally get blown off because you think, well, it's just kind of basic legalese for insurance. But when you think about it, no, this is actually a legitimate question. These are defined in insurance policies, and very few people actually, on the consumer side, actually read their insurance policies. And a lot of times in my business, we kind of take for granted that people actually know what this is. So this is a very legitimate question. So I'm treating this as a very serious question that you need to know this most basic terminology to understand how your insurance works. So let's take these, there's 4 questions here. What is a deductible? What is coinsurance? What is copayment? And why do I have to pay them? We're going to take them one by one as it relates to Medicare, because some of these actually do have different definitions, different descriptions for different kinds of insurance. So we're going to start off with deductible and how it relates to Medicare. What a deductible is, it is a set amount of money that the insurance company is not going to pay. You are going to have to pay it first. After it's met, then the insurance steps in. Now there are some caveats to what comes in under that deductible and all that. This is as it relates, for right now I'm going to speak about how it relates to Medicare Part B. The other thing about the deductible is a deductible tends to change based on, come up again based on when a person, what type of Medicare a person's actually talking about. Deductibles can be an occurrence-based thing. It can be an annual-based thing, or there could be some other criteria for when a deductible comes up. But if we use Medicare Part B as an example, which is the medical side of Medicare, the deductible in 2017 is the first $183 once a year. So what that means to you is the first $183 of the services that you use in the year 2017, Medicare is not going to pay it. They're going to pass that charge on. If there's a secondary insurance in place, like a supplement, and the secondary says they'll pay the deductible, then they'll pay it. If they say that they won't pay the deductible, then it eventually gets passed down to you, and you have to pay that first $183. That's the Medicare Part B deductible. Now, there are some things, again, I'm recording this in February 2017. These things have a habit of changing, plus the what's waived on the deductible changed a lot with the Affordable Care Act. But there are things that do not come under that deductible. But not all. Many preventative services Medicare will actually pay starting at $1. So there is no deductible for, say, mammograms, pap smears, flu shots, for men, PSA screenings, things like that. If it happens within a certain time frame and your doctor is coding it as preventative, the deductible actually doesn't apply. So what you need to know is that the majority of services, a deductible is a set dollar amount where basically the burden of paying it is on you until that deductible is met. We're going to get to why in just a moment. Now, Medicare Part B's deductible is annual. Medicare Part A's deductible is significantly higher, and it is on a per-occurrence basis after a certain amount of time is exceeded. Medicare Part A's deductible says that the first, it's about $1,300 and some change. And, we can leave it that way. That's what it is in 2017. They say that they're not going to pay that first $1,300 plus dollars in a hospital, each time you go into a hospital, if you leave and 60 days elapse and then you go back in, it could be charged again. So if things were timed just the wrong way, you could have conceivably 6 of the same deductibles in 1 year. Now, Medicare supplement people typically don't have to worry about that because almost every Medicare supplement pays either all or the majority of that deductible. But it is there. A person that just has Medicare, there is that deductible. So that's an example of a higher deductible that actually can happen more often than once a year. So the Medicare Part A deductible is a little bit more serious, and we're a little bit more concerned about making sure that that's covered. Now, I'm going to skip ahead on the others to answer the question, why do these deductibles exist? Well, the deductible exists for a couple of reasons. Number one, deductibles are there to keep a person from using services when it's not incredibly needed. Now, keep in mind, this is not the insurance company being a bunch of greedy you-know-whats. This is actually the government's deductible. And the government's saying they need to put something there to make sure there is a little bit of cost, so a person is going to actually say, okay, do I need to use Medicare, or is it something I can just put a Band-Aid on my finger? And don't think that I'm making light about that, because that is actually a legitimate problem that was solved through the use of deductible because it has happened in the past. So Medicare does have that. Basically, they're saying they want you to have some skin in the game. The other reason that a deductible exists is for the insurance side, and the majority of our clients, they've got a Medicare supplement where the Medicare supplement itself does not pay the Part B deductible. It does pay that more expensive and more frequent Part A deductible, but we're generally going to recommend a person consider a Medicare supplement that does not pay the Part B deductible. Reason why? The Part B deductible, like I said, in 2017 is $183. The difference between a Medicare supplement that pays the deductible and a Medicare supplement that does not pay that deductible is typically about $183, maybe a little bit more. And and this is just human nature, this is not a commentary, if you ask a person, would they rather pay a lower premium and pay a little bit of something to their doctor if they have to, which is what you do with the deductible. You pay that money to the doctor or the hospital because the insurance company is not going to do it, so someone's going to. It's going to be you. If they have a choice of paying that deductible to the insurance company, to the doctor, or paying a higher premium to the insurance company so they'll take care of the deductible for you, by and large, the greatest number of people that are given that choice would rather pay less money to the insurance company and pay a little bit money to the doctor. That is human nature. That is the state of insurance. That is perfectly fine. We're going to work with that. So we'll generally tell a person, consider taking a plan that does not include the payment of the Medicare Part B deductible. Keep your insurance premium down a little bit. So that's what a deductible is and why it's there. It's there to basically say, keep in mind the fact that you do have someone else that's going to be paying the bill. Do you really need to use it? If you need to use it, that's fine. You're going to have to pay these first few dollars. But the other thing, it's to keep deductibles are there to keep premium down. It's like your auto insurance. You want to decrease your auto insurance, increase your auto insurance's deductible. Same thing with health insurance. The second part to that question, wow, we're 9 minutes into it and I only answered part 1 of 4. Okay, well, that's the way things are going here, so let's get to part 2. What about coinsurance? So coinsurance defined is a percentage of the bill that you and or the insurance company is left with paying. It is not a dollar amount. Here's what I mean by that. We're again going to go back to Medicare Part B as an example. Medicare Part B, for the most part, is an 80-20 program. And what that means is that the government portion of Medicare Part B, is going to pay 80% of the bill that comes to them to the doctor or hospital on your behalf. The other 20% is your coinsurance. And what that means is the people paying 80% don't care who's going to pay the other 20%. They just know that whatever that bill is, they're going to leave you with that amount. Now, why that's important and kind of the reason things like Medicare supplements exist is because all they do is say 80-20. What is it 20% of? Now, if all you do is go to a doctor a couple of times a year, 20% is nothing. 20% maybe not even $20. The bill left over maybe about, $7 or $8 left over. And if you have a Medicare supplement, the supplement is typically going to pay that remaining 20% for you. Although if you don't have a supplement, you've got it. So you've got a $7 bill, even though you've been paying hundreds each year on your Medicare supplement. But that 20% could also be 20% of $100,000. So all of a sudden, instead of you having a bill for $7, you could have a bill for $20,000. That's what coinsurance is. It can be the littlest charge in the world until such time it is a retirement breaker. It can kill a retirement easily. And it's set up that way. It's a form of cost sharing. Because when a bill goes to an insurance company, or in the case of Medicare, a bill goes to the government, the government is not going to know overall what they're going to be able to calculate in their costs. So, for example, they know, okay, you're going to need a CAT scan. It's $5,000. And I don't know, you see a doctor afterwards, an office visit's going to be $100. Well, they can easily predict, okay, for $100 you'd have to pay maybe $5 left over, and for the but for a $20,000 bill, you're going to have to pay $1,000. But they don't know if it's going to be $20,000 here with provider A that gives that CAT scan, or it's going to be $25,000 here with provider B. They don't know that. So rather than them just kind of setting everything up to where there's kind of a flat amount, because don't forget, it's the people providing you medical services that could significantly be hurt by that, because if they have to cut down their costs, well, okay, the doctor needs to get paid, the doctor's office attendants need to get paid, the nurse needs to get paid, the people that are going to set you up and prep you need to get paid. There's a lot of human cost associated with medical care, and so the insurance companies and the government try to stay out of that to an extent that they know they really don't want to kind of mess with people's income, or they want to mess with people's income as little as possible on that. So rather than kind of get everybody into a controlled cost, which may be fine for some, but a significant reduction for others, they just say, okay, we are going to say 20% left over, whatever 20% of the bill is. You're going to send that to somebody that's not us. We're going to pay 80%. It's going to be a fluctuation. We know we'll deal with that, but we're going to be paying 80% of it. So that's what coinsurance is. It is a percentage of a percentage of that cost. And the last one is copayments. Now, a copayment is a specific dollar amount. And what that would mean to you is very simple. Your $20 copay, your $100 copay, your $300 copay. It gives you an easy-to-budget amount that you know that you're going to have left over that the government is not going to pay, the insurance company is not going to pay, or some combination of other people is not going to pay that amount. That is what a copayment is. And then finally, the last question is, why do I have to pay them if I have insurance? Well, it's so that, again, this goes back to the deductible portion. Why do you have to pay a deductible if you have insurance? Why do you have to pay co-payments if you have insurance? It's so that you don't abuse insurance. And again, I'm not saying that people inherently abuse insurance. That's not the case. But it is trying to get people to have some skin in the game. There is a fair amount of statistical data over the time we have had health insurance, which is basically a little bit over 100 years, that says that if 100% of all bills are paid with absolutely nothing coming out of the pocket of the individual except for the premiums, there is going to be a little bit of an abuse on healthcare with some people. Now, how big statistically is that amount? Actually, it's not that big, but I mean, it is there. And when you're dealing with anything where a person, when you're dealing with money, when you're trying to categorize how much money we have to charge for how much money is going to be going out to pay these claims, you do have to kind of do every little thing to make sure that your premiums stay level and that you're not paying out for abusive charges. Is this everybody? No, but it's enough where insurance companies a long time ago, to a point where even the government does it, says that, okay, we want people to have some sort of skin in the game, even if it is only $10, even if it is only $20, we want people to have some sort of charge that they're going to have to pay so that they at least give it a little bit of thought as to whether or not they need to actually utilize medical services or not. So that's the reason why you do have to pay it. Now, it's a little bit, all of this is a little bit different when we get into Medicare D, the prescription drug plan. These also have deductibles, coinsurance, and copayments. Basically, they call all of that area the cost sharing. And this is something that's Part D for all it's done. We think it's kind of intrinsic. It's not. Part D started in 2006. So the recording of this video, it's 11 years old. There's still a lot of things being worked out on the prescription drug plan side. And like it or hate it, I was doing this before Medicare Part D existed, and there was nothing. So if you did not have an employer plan taking care of your your prescription drug services, there was very little to absolutely nothing that would be able to cover your prescription drug services. So as much as you may love or may hate Part D, it's a lot better than what it was, which was, you got pretty much a kick in the you-know-where for it. So it's there. And what Part D says is, except for the absolute least expensive medications, we're going to make you pay a little bit of something for your medications. Why? Because Medicare and even insurance companies found there are not enough people asking their doctors, is this drug necessary? Are there other drugs I could try that's a little bit cheaper? Or are there some lifestyle choices that I may be able to make where I could do that instead of take the prescription drug medication? This is not commentary on me saying to the doctor, okay, you're overly prescribing expensive medicines. I'm not. Because sometimes those expensive medications are needed because the doctors found out that this is the one thing that's going to make you healthy. And if it's the one thing that's going to make you healthy and it's an expensive drug, yeah, there's going to be cost to it that maybe I'd be able to help a little bit with, and maybe the doctor will know some programs as well that they'd be able to help with, but there are costs. These costs were there. They were placed in the plan because, by and large, there were a great many people that were just not asking the question, okay, is there something cheaper that I can try first? Now, that's changing as more people are getting the message because of those costs. More people are realizing, okay, I've got to maybe see what can I do to get these costs down, to bring these things down and everything. But that is a consequence. That is not a result of having Part D. That is a consequence of having this these deductibles, coinsurance, copayments, and I haven't even talked about the donut hole yet. That's for I'm sure that's a question we'll get to later. But the donut hole is basically a form of coinsurance these days. But it's doing its job. The reason why you have to pay those coinsurances and copayments, the reason those exist, is because people are now asking their doctors whether or not they need to take those drugs. That means that it's working. And I can tell you again from experience that I am seeing a whole lot more people that I don't have to say there is a generic equivalent. Can you ask if you can safely take that drug instead? And I'm not talking a similar drug. I am talking the exact same drug in generic form. When Medicare D first started, I saw a whole mess of people that were taking very expensive $90, $100, $150 brand drugs when a $10 generic was right there available, and at least in this state they could just ask their pharmacist to take it if they wanted to, but I still told them to ask their doctor if there's a reason why not. I don't see that anymore. People are now getting smart enough to know, okay, this is going to cost me a whole lot of money when I go on Medicare, so I better start checking with my doctor right now to make sure, can I take the generic? We okay with it? By and large, a lot of doctors are very price conscious about that now, and I think that's fantastic. For the most part, most doctors know enough about the program and the cost their patients face to know that if there's something they can try their people on first that's cheaper, they're going to try it and then move them to something that's more expensive, only if it's necessary to maintain their patients' good health. But still, that is the reason. Skin in the game. Getting people to not abuse programs and to do things as effectively yet inexpensively as possible is the reason why coinsurance, copayments, deductibles exist on prescription sides. It's the exact same thing on the medical side, and that is the reason why there is a little bit of something to pay on just about every form of health insurance available to anyone at any age in this country.